in, press, tension, go ahead. Client moves, and sometimes you got to give a little extra help, and it's going to be a gentle. You're not going to force it. You're going to take it just past parallel of the hip here, and you're going to go nice and slow, because if you're too quick, it's not going to feel great for the client. It's going to pull that nerve really tight, and you're not going to get an effective treatment. Once you find that area, what you're going to do is you're going to be right over top of it. Your thumb is going to be in just like that, and you want to be up on your toes, arms nice and straight, and you're going to lean in just like that, and then you're going to get some more depth by pushing with this opposite arm, and then your tension is going to be that slow body lean, and then the client is going to start to go through that motion and start to move that, and you're just going to keep your sternum right over the top. And sometimes when they're really having some trouble moving that, you're going to sink in, push in like that, tension, go ahead. And you might have a client that has some trouble with that. What you're going to do is readjust, and you're going to get the rest of that motion in there to open up.